J'ai maintenant le plaisir d'accueillir Dr. Antoine Boivin sur la scène. It is now my pleasure to introduce our first speaker, Dr. Antoine Boivin. Antoine is a primary care physician and co-director of the Canada Research Chair in Partnerships with Patients and Communities. No stranger to Canada's strategy for patient-oriented research, Antoine had served previously as a co-director for the Quebec Support Unit. For the last 2 decades, Antoine's clinical practice, research, and teaching have all been conducted in partnership with people and communities. Today, we're privileged to have him speak with us about ecologies of health. At the end of Antoine's address, we will open the floor for a few questions by moderated session. To ask a session of one of our keynotes, please go to the Whova app. At the bottom, it will say Session Q&A, Keynote number 1. You can also find this in the digital agenda. Post your question in the chat box. The most requested questions are likely to be selected for discussion. Now, please join me in welcoming Antoine.
Thank you for the gift of your presence and of your attention. I would like to share the story of Jane because it's a person I care about. Jane was my ghost patient. She had been registered to my name by the list of vulnerable patients without a family physician for 3 years, and I had never seen her. I called her, offered to visit her at home to see the nurse, the social worker, the psychologist. She refused everything. Until one day, I offered Jane to meet somebody I trust, my colleague Ghislaine. So she came to the clinic. I introduced Ghislaine, let the 2 women talk. And Ghislaine introduced herself as not a healthcare professional. She said, "I'm just a patient, just like you." And they started to talk for an hour. By the end of the hour, Jane asked Ghislaine to accompany her back to her home. And that's where we started understanding what was going on. All these solutions I was trying to offer, they were the solutions to the wrong problem. Jane was living in poverty. She was ashamed of her home. That's why she didn't want me to come. She had issues with childcare services in the past, so she didn't want to see a social worker. But just a patient like her, that worked. And it created this small connection of trust that slowly helped us understand what truly mattered for Jane, what were her goals. Her goal was to see her granddaughter grow up. Her daughter was pregnant, and she was hoping to see her. And so Ghislaine started to reconnect care around these goals. Food on the table, clothes for her children, and slowly trying to understand what was her health condition, what she could do to be better and to see her granddaughter. And slowly, Jane became my best patient. She started texting me when she had questions. She accepted the home nurse. She started dialysis. She lived a few more years, and she got to see her granddaughter. And I saw her granddaughter last month. She's 8-year-old now. And her mother said, "Oh, this is Dr. Boivin. He's known your grandmother." And so she's still alive in me. That meeting, that encounter, it changed my life. It changed my medical career. It changed my research career. I was like, how could a woman without a university diploma succeed where a whole team of qualified academic clinicians had failed? What was the secret? What was hiding into that treasure box? And so for the next decade or so, my quest has been to understand this woman and what she does. And that's a little bit of what I would like to be sharing with you. Although the best thing would have been for you to meet Ghislaine, but I'll tell you where she is a little later. So this story is a story about care, about caring alone, caring with people, and caring with communities. So I was trained over 20 years ago as a physician, and I was trained to be in charge of people, to find solutions for them. And for a little while, it worked perfectly. I worked in the intensive care unit, the emergency room. I saved lives. It felt amazing. And then I moved to Center South Montreal for primary care practice, one of the poorest neighborhoods of Canada. And suddenly I started to feel disempowered as a physician. I felt like all of my tools were insufficient. I was a poor substitute for a caring friend, for a decent income, for a safe home. And I started feeling quite desperate, actually, as a caregiver. Until I met Ghislaine. I met Ghislaine in 2013. That's almost 15 years ago. I met her in medical school, except that she wasn't a case that was being discussed in medical school. She was the teacher. And I was sitting in the room listening, mesmerized. I thought, this woman is amazing. I had a professional crush on her, and I invited her for a date. We went for a coffee, and we had a dream. We had a dream of caring for people together. Ghislaine started telling me that she was born a patient. She had been a patient all her life, and when she was 15-year-old, she was hospitalized, and in the bed next to her was an older man who was suffering at his end of life, calling for help, though nobody else was responding. And so Ghislaine, with her hospital gown, she stood up and held his hand until he died. She learned to be present with. She couldn't do anything, but she was there. And that's how it began for her. And now for over 60 years now, Ghislaine has been accompanying people through challenges in their life. And so it began, our experience in caring together. And initially, it was amazing. One of the first patients we saw was George. I had diagnosed George with metastatic cancer, incurable cancer, a couple of weeks ago. There was nothing that the specialist could do. He had no pain. As a physician, I had nothing to offer. And George was angry. He was angry of dying, basically, and I didn't have a pill for that. I asked him if he accepted to meet with Ghislaine. She sat beside him, and he started explaining his story, and at one point he said, "You're not saying anything." And she said, "I understand why you're angry. I've been angry too when I got my third cancer. Now, what are you going to do with your life?" And then George started thinking. And then he called an old friend he hadn't seen for 20 years. And they went fishing together. And then he started gardening on his little balcony. He even made a girlfriend. And we saw George a week before he died, Ghislaine and I, on his bed, beside his bed, and he was glowing. This last year of his life had been one of the fullest year of his life. And Ghislaine told me afterwards, as long as you're not dead, you're still alive. And gosh, this woman is still alive. I'll tell you, it's coming. So to me, these were small miracles. And I started talking about it. I started moving up the stairs of the healthcare system. Listen, I found something. It's amazing. I even had a meeting with the health minister. And the answer I got everywhere was, "This is amazing. Keep going." And there was no budget and no support and no... So the other thing that happened is when word started to spread that there was a patient in the clinic seeing other patients, I was summoned by the board of directors. They said, "What is this thing? What's going to happen if we get sued?" And so Ghislaine was also worried about safety, and she said, no, we need to do things properly. And so we started a research project, and Ghislaine became an experimental treatment, and people signed a consent form before seeing her. Said, let's, it's like patient talking to patients. It's never been seen before, so you need a consent form. And people started to quiet down in a way. So research, before it produced any knowledge, it really created a space to try to care differently. And so for many years, we learned together to care together within the space offered by research. And then a couple of years ago, years later, for about 5 years, it was just the two of us. And then one day, there's one of our colleagues from down the hill. He was working in the homeless clinic. He said, that's pretty cool what Ghislaine and yourself are doing. Could we do this with somebody who's experienced homelessness? And we said, why not? Let's try it. And so we met with Daniel. He had had an experience living in the streets. He'd had several issues, and he wanted to give back. And we met him with Ghislaine, and she said, he's got it. I don't know what she talked about, but she recognized it. She said, he has it. And so we got a little bit of a pilot research project with Daniel, and enough money for 1 year. And Daniel started working at the Community Health Center on December 1st, 2020. And I remember the date because this was the peak of the second wave of the pandemic that hit directly the homeless community in Montreal and across the country. It was the middle of the winter. The teams, the community organizations were shut down. People were exhausted. And people on the team said, this is not safe. This guy's had issues with, homelessness and mental health issue. It's really tough work. Are you really sure you want to try this? So after 2-3 weeks, we had a meeting with Daniel and the medical director of the clinic. Daniel was beaming. He was smiling. He was helping people. And he had started to do cross-country skiing. This was his first job in 10 years. And the medical director was green. He was exhausted. He hadn't taken a break in months. And at the end of the meeting, Daniel said, maybe, Mathieu, you should take your weekend off. And then it hit me that those people that we think are vulnerable actually have built quite important strengths in navigating challenging times. And I was really surprised to see this, such as all the team. And after 6 months of experimentation, our attempt to get renewed funding failed. But the clinicians and the managers on that team, they said, this is so extraordinary what we're witnessing here. We want to keep him. So the manager found some money. After a couple of months, a permanent position opened. The manager said, okay, let me draft this in a way that he can apply. And Daniel now has been a permanent employee of the public healthcare system for 5 years. That was before we published any research paper. So translation, it went pretty quick that time. And then one day I met with Penelope. Penelope was the nurse manager of Doctors of the World team. They'd been in Montreal for 20 years to care for people who cannot access the public health system, sex workers, people with substance use, people experiencing homelessness, etc. And for the past 5 years, Penelope had started to build our dream team. She had a team with half of the team were people with lived experience, and the other half were caregivers with diplomas, and they were working together. It included indigenous navigators, migrants with precarious status, people with previous issues with mental illness, with substance use, working alongside nurses and social workers. I was like, this is actually happening. And so what we became then as researchers, we didn't invent that team. What we did was simply shed light on what already existed that was just beside us in the community, but we'd never heard about it because they didn't have a research team, it wasn't published, it was right in front of our eyes. And so slowly we started connecting these teams who were attempting to work with people with lived experience as part of the team. And so we became a little bit of an alliance, a couple of those teams working together. And what I had seen with Ghislaine, we saw it elsewhere. But all of those teams were facing the same challenge: to be recognized, to be supported, to be integrated with healthcare system. After 10 years of experimentation and over 10,000 hours of care, Ghislaine is still not receiving a single dollar from the healthcare system. Her work is entirely funded through research. And I'm not so much worried about doing the grant application and all of that, but the worry that's been in here for me for many years now is this going to die with us, and is this going to die with her? How can we share this in a way that is sustainable so that other people can benefit from this very simple, humanly sourced thing, being presence, listening, being there, walking alongside each other. 2 years ago, Ghislaine said, or a couple of years ago, Ghislaine said, Antoine, you need to go outside, see the world, and let's learn from other people. So this is our caring community. The first connection we've had was with Japan. One day I received an email from somebody in Japan who said, hey, this caring community you have in Canada, it looks pretty cool. Can you help us in Japan? I was like, I don't know anything about Japan. And so we started conversations for 5 years. And then this team from Japan came over to witness Ghislaine practicing. Right now in my clinic, many people don't really know Ghislaine, but we've got people flying all over from Japan to spend a day with her. And this team from Japan, they came with Mrs. Murai, and she's an elder woman in Japan who had started this community work. And she was a bit of a Ghislaine, but from Japan. And rather than accompanying people one-on-one, she was doing this collectively in the community, in groups, and all of that. And so they became friends, and we became friends. It's like growing a root across, and we started inspiring each other. In May 2024, I was invited to Geneva. I didn't know exactly what was going on, and 3 days before the conference, I read this thing. It was a draft resolution on social participation in health and well-being. And the next week, all members countries, 194 countries, adopted unanimously a resolution on social participation in health, recognizing that governments need to partner with people, with communities, with civil society in order to solve the health challenges that we face. We cannot do this alone as health professionals and as healthcare systems. We need to work together. And so to us, that was an opportunity to link and connect with other initiatives in the countries working with the same values. I had the chance of being in Thailand and witnessing with my own eyes 2,000 Thai people meeting together to deliberate on policies affecting health and well-being, including housing, including the economy. 10% of these resolutions translate into law. I met with people in Brazil. Brazil, after its military dictatorship, embedded in its constitution the right to participate in health and education, to the point where right now the Brazil healthcare system has 200,000 community health workers, people like Ghislaine, working with healthcare teams in communities funded by the public healthcare system, serving 200 million people. I met with Viv. For 30 years has been connecting, and Norma, working together in Big River First Nation in Saskatchewan. I connected with my friend Maxime. He's an environmental scientist. He works with Inuit communities in Nunavik to monitor the impacts of climate change on the health of people and communities. I met my friend Janie. She supporting living books, people with experience of poverty and marginalization, to get them to have coffee and meet with policymakers in Parliament, to get them to see poverty in ways other than through statistics. And we met colleagues in India, and this is the punch. Ghislaine couldn't be here today because on Saturday she flew to India, and so this is Ghislaine from yesterday at almost 80-year-old. So that's the kind of woman she is. And after a couple of months, we started asking ourselves, who are we? What do we have in common? And one member of our team, of our alliance, of our growing global alliance said, well, we are communities of solutions, and we've worked together for several weeks to define what this means for us. And communities of solution for us means people with different strengths, transforming shared dreams, dreaming together, moving from I have a dream to we have a dream, and turning these actions into collective actions for the well-being of people and communities. So that's who we are. Thank you.
Hello. I know we each have one. Testing. Okay, great. Excellent. Thank you so much, Antoine, for your presentation. Ghislaine sounds like quite a spark. We are running a little bit over, so we just have time for one question, but Antoine will be here today, so there's lots of really, really great questions in the Whova app. Thank you for those who've participated. If you would like to connect with Antoine at the break or any time during the day, please do so. So Antoine, a lot of really great questions. I'm going to pick one about emergency departments. So we're seeing increasing rates of patients leaving without being seen in our emergency departments. Have you seen organizations successfully deploy patient partners such as Ghislaine or peer navigators in waiting areas to improve engagement and reducing walkouts?
Yeah, one question we've been asked repeatedly is, how do you clone Ghislaine? And it's a really tricky thing when I talk about Ghislaine, is she is an extraordinary woman. And what Ghislaine says is there's thousands of Ghislaine out there. And the people who listen the most are often the people we hear the least. And we need to simply pay attention. We haven't invented anything. We've just reconnected worlds of care that exist naturally in communities, people helping one another with the professional healthcare system. And that happens everywhere. So it's not about inventing it, or it's not about creating it, it's about connecting it. And yes, I've seen this in all sorts of situations. And we've got to simply try to make that connection. And if you're curious about this, I've left a QR code. And these are sparks for change. Okay, it's not sparks for inspiration. Hey, I've met this, but sparks for change, for let's try this at home. And just knowing that this is possible, and the infrastructure is very simple. You know, it's people working with people. So that's what it is. So it is very simple. We just need to try to work together.
Excellent, thank you. Thanks, everyone.
Thanks very much, Antoine and Monica. Hi, everyone. My name is Larry Miraz. I am the Patient and Community Engagement Lead for the BC Support Unit. And we're about to move into our break. Hooray! But before we do, I have a few reminders for you. We're running a bit late, so I think your program says 10 o'clock, but our breakout sessions will start at 10:10. So around that time, we ask you to make your way to the various breakout rooms that will form the showcase for our conference. And if you haven't yet, you can check on the Whova app to find out what the program is and which rooms you'd like to attend. The presentations will run concurrently, so choose from a selection of breakout rooms. And for those online, wherever you are, you can join the Zoom links that were featured on the app on the session card, or you can find them in the email that was sent to you yesterday by the conference organizers. And there should be a QR code coming up. Well, maybe not. But we do have a few breaks during the day. This is one of them. So please take this opportunity to refill your coffee, tea, water, or whatever else it is that you want. But we also have a bingo card. So please go get the bingo card and connect with other people and start filling that out, because there's a draw and there's a prize. I want the prize. Is it chocolate? No? No chocolate? Okay, never mind. I can't promise that. Oh, and there are booths. So please, when you're drinking your coffee, go to the booths in the Shaughnessy Salon Room. Lots of great booths, but one I want to tell you about in particular. Okay, this is one on our journey map. We're looking for people to give us feedback on this web resource that we're developing. And we're looking, this tool helps researchers go through the patient engagement journey in their research cycle. So you'll find that in the back of the Shaughnessy room, right next to the clinical trials. All the booths are great, but I want you to go to that one if you want a prize. No prize for that. So please go to that. Enjoy the showcase session. And now I'm stopping you from having your break, so go and have your break, and see you at 10:10 in a breakout room. Thanks very much.